Hello there, and welcome to Health Vibes, your weekly dose of health, wellness, and everything in between. We are here to empower you with expert advice, breakthrough discoveries, and practical tips on how to take charge of your life. From fitness to nutrition to mental health to medical insights, we have got you covered. Whether it's transform your life or just to be informed, this is the ultimate guide for a healthier and happier you. So sit back, relax, and better still, move around whilst we dive into today's topic. This is Health Vibe. Welcome back. Now, my resource person is all seated and ready. But before we dive into today's topic, which is malaria, let's head on the street for our Vox Pop views.
Have you experienced malaria before?
Yes, I have. I really felt feverish. I felt weak. I couldn't eat. I lost appetite, and I just couldn't do anything.
It wasn't pleasant. You feel dizzy sometimes, tired, and cold, feverish sometimes.
Nake incho gbami nda mi njo mi ni te drosto ake o noni fio me ba 2D ni ngba na iwa ha mi 2D chufa.
Eha ye he mi kra nga mi ye le idola inyo e ma wasi fie nga mi ye
Me honam nyinaa yɛ me ya ebubu me na mentumi nsɔre koraa.
What did you do?
Well, I visited the nearest pharmacy. Then I took a test, and then when it came out positive, and then I took medications.
Well, I called my doctor and she asked me to meet her in the clinic. We did some tests. It was positive, and then she gave me some medications.
Oh, just pass it. I call mommy. Where mommy can carry me go hospital. Where then give me some 3 injections. Where then give me medicine. Take come house.
iya pharmacy ne ya de kechon ne ne menanga chupa adwa ne aha mi chupa ke ma ba no ligi eten
Me a me pedro no me yɛ bibiduro.
When you had the malaria, were you able to have any sexual intercourse?
Well, it became a stumbling block at a point in time, but yeah, you still have to turn up.
I didn't have that in mind.
Okay, I see. All right.
He not come my head inside.
ikpo peda bi ne malaria na mi be ne fie nga mi ye ne nga mi pe ha ye ha ye dwa mi je kolo no
Oh, me honam nyinaa yɛ me ya ntu mentumi anyɛ hwee.
Can you kindly tell me what causes malaria?
Well, it's caused by mosquitoes, especially the female Anopheles mosquito.
The little signs I know tells me it's caused by the female mosquito. When you are bitten by the mosquito, then in some days you get infected.
Dirty waters, then when a rubbish way, they cause the malaria.
kenyu da singa owenya lo nyunga he no nge lo ole jo nga hinga le jo ne epo ile jo po fali fali wio pumi manye ma semi lo ma lange mi meke ekomu o mana malaria
Efi ankasa na ɛde malaria ne ba because efi ni ba saa na ɛde ntontom na ɛba na ntontom so esi ho na ɛka wa ɛne ne malaria no.
Welcome back. Now, that was quite an interesting box pop. We all get malaria, and we all know what exactly causes malaria, but we don't know the nitty-gritty of what exactly it is. And that is why my resource person, Dr. Freda Dodd-Glover, is here to educate us more on what malaria actually is. Hello.
Hi,
Welcome.
how are you?
I'm good. So, let's start off with the background on what exactly malaria is.
So it was really lovely listening to everybody talk about what malaria is. And it's nice to know that many people know that it's caused by the female Anopheles mosquito. So yeah, kudos to you guys. But it's actually caused by a parasite, right? Malaria is brought about by a parasite called the Plasmodium parasite. And the insect that carries this parasite is the Anopheles mosquito. So the female Anopheles mosquito. The parasite goes into the blood and causes the disease. Now, in our area of sub-Saharan Africa, we tend to have what we call the Plasmodium falciparum parasite, and that's common, for causing malaria here. In other areas of sub-Saharan Africa, they have other species of falciparum like ovale, vivax, malari. They cause malaria in those areas. Sometimes we tend to find pockets here and there of these other species in Ghana as well, but it's mainly the Plasmodium falciparum.
In Ghana here.
Exactly.
And all these different species cause malaria.
They cause malaria. Yes.
They don't cause a different kind of malaria.
Well,
it's just good old malaria.
Like, it's malaria, yes. Some will be more severe than others, yes.
And I'm sure the ones in Africa or Ghana are severe compared to the other places.
Malaria can be severe depending on how much parasitemia you have, meaning the quantity or the load of parasites you have in your blood. Okay, so if you're non-immune, for instance, people that stay abroad and they come on visits, they are not exposed to, the parasites. When they get it, they are likely to have more severe disease than people that live in the country.
What then happens to the male mosquitoes?
Right, the male mosquito does not transmit the Plasmodium parasite. It causes other conditions like elephantiasis, for instance.
And that's also a very dangerous one.
Yes, it is. Lately, it's not as common because there are programs, Ghana Health Service has all these programs trying to eliminate some of these conditions. So lately, we don't find many cases of elephantiasis. But yes, I'm sure some children don't even know what elephantiasis is.
Exactly. Because you hardly see someone with elephantiasis because you see it with the
big feet.
Yeah, you hardly
because it blocks
it.
their lymphatic system and leads to the limbs becoming very big.
So how is it that Ghana Health Service is able to work or deal with elephantiasis, but malaria is still rampant?
Malaria, unfortunately, is more difficult, because there's seasonal transmission. So, for instance, during the rainy season, which we've sort of ventured into, the mosquitoes breed a bit more, They are everywhere. And if we don't take in measures to prevent them coming in, biting us, then they go to the next person, they bite. So the transmission is very rampant, And it can take about 28 days, a little over, to get a new infection. So, the cycle, that's why we say it's perennial. It's always with us. It's not something that comes like, let's say, just for 2 months, it goes away, the next year comes. So it's really difficult to control malaria.
Wow. This is a funny one. I know it's very difficult to tell because mosquitoes are tiny, but is there a way to know that, this one is a female and this one is a male?
No, no, really, it's difficult to tell.
But there are these black ones, they're very black. It's different from the other ones, I think, brownish.
Lately they say they've discovered a species of the Anopheles known as the Stevensii. Yes, and that one actually, it helps malaria to spread more in the dry season. So it's another reason why during the dry season, malaria still goes on, even though the burden of malaria is during the rainy season. Yes.
So it looks like malaria is here with us.
It is here with us, but we're trying to eliminate it. That's why we're making noise about it, right?
So what are the symptoms should someone have malaria?
So like we clearly heard from the Vox Pop, yes. I think they described it perfectly. So most of the time, the symptoms, they are what we call non-specific, So a fever. Now, I must say that in Ghana, when people say fever, they actually mean they have malaria, but that's not what a fever means, So in medical terms, when we say someone has a fever, it means their body temperature has gone up.
Wait, so not the... Did they feel the chills you get?
When somebody says did, it means different from one person to the other. So yes. So when we say fever in medical terms, it means that your body temperature is gone up, and you can test this physically by touching, and you know that you're warm. So that's a fever. Now, a fever can happen in many conditions, like a urinary tract infection, pneumonia, meningitis. So many things can cause a fever. But if you have a fever over about 1 to 2 days, you have body pains, you feel a bit nauseous, it could be malaria, it could be something else. That's why it's important to test. So you go to the pharmacy or you go to a hospital, they take some blood, they do the blood test. And the blood test, we have 2 types. There's a rapid one where they just drop it like a pregnancy test, and that's called a rapid diagnostic test. And then there's the one that goes under the microscope, so microscopy. And that one can see the parasites. Remember the parasite we spoke about? Yes. Yeah. So you can actually see the parasite and confirm that you have malaria. So these are some of the symptoms. Now, we have what we call uncomplicated malaria. So uncomplicated malaria, you just have the fever, you're not feeling well, you can't eat well, like they were asking about sex, you can't do
the do.
Yes, you can't do the do and all of that. So that's uncomplicated. But once you're tested, you take the malaria, you feel fine in a few days to a week, you're okay. But for the complicated malaria, they can't even sit up. They are so weak that anything that goes in comes out. Okay, they are coughing. Sometimes they actually go into a coma. Yes.
Wait, with malaria?
With malaria.
That's the
they can go,
plus one.
Yes, they can go unconscious. Okay.
Wow.
Yes, so this can happen. And to the extent that it can even cause your red blood cells to break down. Okay, so it's breaking down, and then when they do your full blood count, your HB is dropping. So maybe your HB was around 12 because your malaria is causing the red blood cells to break down. Now the HB goes from, let's say, 11, it's going down to 9, it's going down to 7. So it can cause severe malaria. Okay, and these pigments that are released from the broken down red blood cells, they go and are deposited in the kidney. Okay.
Wow.
And they can damage your kidney. So now you can't produce urine and you get what we call acute kidney injury. Some people even need dialysis.
For malaria?
Yes, to recover from this. And now if that kidney injury is not picked up early, okay, because you're not able to bring out urine, you're going to have a fluid backup in your body. And that will go into your lungs. And so now your lung is flooded with fluid. And so now it's not only your blood that is breaking down, you have severe anemia, you also have kidney problem. Now because it's breaking down, it's going to release a pigment called bilirubin, and that's what causes jaundice. So your eyes are yellow. Okay. Yes, yellow
from
eyes
that tiny mosquito.
Yes, from that tiny mosquito. So this is causing a multi-organ failure, okay? And they can go to the brain, and that is what causes the coma as well. And they can cause seizures. So they are there and they're just shaking like that. Yes, and if it's not treated early, it can be fatal. So malaria can kill.
So these are like extreme cases where
they are extreme cases.
You neglect the symptoms and then you don't take precautions.
But there are some people, like I mentioned, that some people are non-immune. So for us who stay in Ghana, this is where we live.
So we are used to it.
We get malaria every now and then. So you get some form of immunity. It doesn't mean you won't get malaria in the future, but when you do get it, it will not be as severe as somebody who is coming from abroad. Okay, so they can get a very fulminant or very bad, complicated, severe malaria. Okay, which if not treated early can be fatal.
Okay, so are we getting immune because we've had malaria and we've taken pills? So the pills have these kind of things that protect us, or because we're Africans, we naturally have the immunity?
Right. So it's not the pills. Whenever you get an infection, right, and your immune system is what naturally protects you from getting infections or will try and fight off infections. If your immune system is working, then your immune system is going to release these soldiers to go and fight whatever infection is there. Okay. So once you've had malaria, you form some antibodies in your body, so that the next time you get malaria, these antibodies try and go and fight the infection quickly. And so you might get symptoms, but the symptoms are not as bad. Sometimes when your immune system is a bit overwhelmed, from stress or other things, then the infection tends to be a bit more severe. Okay. But this is what the immunity is about. So for people that have never been exposed or they haven't been repeatedly exposed to malaria, they don't have these antibodies, so then it's easy for them to progress quickly with the disease.
Right. So aside the mosquitoes, could our living condition cause malaria?
Right. So remember I said that malaria is caused by the parasite. So you need the parasite. And the only way that the parasite will get into your body is usually through the bites of that female Anopheles mosquito. But there are conditions that can enable growth and thriving of these mosquitoes, right?
Yeah.
So for instance, we have stagnant water bodies around. Okay, our gutters are choked, so because there's all these rubber bags and all these sachet water, in the gutters. So the water, instead of flowing, it's stagnant. Now you're going to have mosquitoes breeding, and once they breed and they go and bite one person that has they'll take it to the next person. Okay? Now, if in our homes there are bushes all over, they also breed in the bushes. Okay, so yes, that's also a breeding ground for them. If your netting on your windows, they are torn, the mosquito will pass through and come and bite you. Exactly. Okay, so these are certain things that are living condition. Or some people fetch water, okay, or they have like garbage bins and there are no lids. So when it rains, the water collects there. They have garbage. breeding ground for mosquitoes, or even water that people use in their households, but they don't cover it. Also a breeding ground for mosquitoes.
Sure.
So all these water bodies, people are building, they have manholes, water collects in there. So we need to be mindful of some of these things, and then try to prevent the breeding grounds.
Okay.
Because that's how the mosquitoes will breed.
Sure. So with the preventive measures, aside keeping your environment clean, is there other forms?
Other forms, yes, there are. So we haven't mentioned it here, but insecticide treated nets. So now they're called long-lasting insecticide treated nets because they have medications in there, that repel the mosquitoes. In the past, the medications that were used to treat, they didn't last that long. So yes, initially, remember that some time ago they would say that every 6 months to a year you need to soak your thing.
Yeah.
But now they are long-lasting, so they can last at least up to like 3 years. So you don't need to do that. If it's your nets are torn, then they're not going to work because the mosquito will pass through. So if they're torn, you need to sew them up. If it's been like 3 years, you need to change to a new one. They don't last for 100 years. You understand? You need to change them. So yes, the mosquitoes, yes, I mean, they are out to get us, but you can do that. So one way, insecticide treated net. Another one is something called indoor residual spraying. That's more of like, let me say, a government task in a way, because it has to be done across a number of households in an area for it to be effective. Okay, so this is where they go and spray certain areas, especially the walls. Because after the mosquito bites you, it goes to rest on the wall. It's tired. It needs to rest. You understand? It's a queen. So once we spray these areas and they get there, the insecticides on the wall, they kill the mosquitoes.
But it would have bitten you already.
Yes, it's bitten already, but now it's dead. They can't go and bite the next person.
Okay.
Do you understand? Good. And these indoor residual spraying, they can last about a year. Okay, so every year it needs to be done, but they need to spray about 80% of the houses in a certain locality for it to be effective. If you only spray your house, no, the mosquito is going to it will come and bite you again. So we need that kind of community thing. Okay, so willingness for people to come into your home to do the spraying. That is one of them. Then there's vaccination, which is great news, because when our children go for their regular child welfare clinics, they can get vaccinated. The vaccines on the market now, they are not in every region, but Ghana Health Service is rolling it out for children between 5 months to 2 years. They can get the vaccines, and there are 4 doses. Okay, so 6 months, 7 months, 9 months, and 18 months. They get the vaccination, and you know that it provides them with good immunity to prevent them from getting severe malaria. It doesn't mean they won't get malaria. They can, but it's a mild form of malaria.
Okay.
You know that it's not going to kill them.
It's not going to kill them.
Another way that we can prevent malaria is by what we call the intermittent preventive treatment during pregnancy. So pregnant women between 16 weeks to about 36 weeks, they can take 3 doses of some medication, special medication, to prevent them from getting severe malaria as well and transmitting it to their unborn children. And the people that are really at risk, pregnant women, children under 5. So another way of preventing malaria transmission is what we call the seasonal malaria chemoprophylaxis or chemoprevention, where these children are given some medication, during that season, to prevent the spread of malaria. So these are some of the ways that we can prevent. And obviously, like I said, maintaining our environment. We also have insecticide repellents, mosquito repellents
and
that we
sprays
can use.
And coils.
Exactly. Wearing long clothing when you're out in the evenings. Remember that mosquitoes, they're also attracted to dark things. You know that. Haven't you seen that when you wear black, they come around you. You can try wearing lighter clothes, long sleeve clothes when you're out in areas where mosquitoes are known to abound.
So is that to say that they are attracted to dark-skinned people then first?
Well, actually, do you know the reason why pregnant women are at high risk?
No.
Because they release a lot of carbon dioxide, and mosquitoes like that.
Right.
And they also have like high body temperature. They like that. So they're really attracted to pregnant women. So not necessarily black people, but yes, they like dark things. So you notice that if you have like your hair is bushy, they'll come around your hair.
Yeah,
Nice.
it's true.
They like dark things and dark spaces. That's why they hide in the dark.
The dark.
Okay.
So, Doc, if you have malaria, what exactly should you do?
Please, you can either walk into a pharmacy, okay, or a primary healthcare setting. Primary healthcare setting can be a CHIPS compound, okay? It could be a polyclinic. It could be a private hospital or a pharmacy. So the pharmacies have test kits, okay? And the test kits, they come with certain things that like a buffer solution and all that. So they have to have the right equipment to be able to test you, okay? And then give you the correct results. Otherwise, they might end up getting the wrong results, okay? So once you walk in there, you're able to get the test done. And if the test says that you're positive, okay, then treatment will be given to you. Now, when you go to the hospital, they also have the rapid test kits, okay? They look like the pregnancy test, if you've seen one before.
So that one, with that one, you also need to pee on it?
No, this is a blood test.
Okay.
You don't
because
pee
the
on it. That's a
pregnancy
very good
one.
question. Yes, this one is blood. They take blood and they put it on. The pregnancy is urine. So please don't use urine, okay? They need to take a little bit of blood and then put it on there. And then I think you get like 2 lines that tell you that it's positive. Okay. In the hospital setting, they also have the test kit, okay? So they can also do that. It's a rapid diagnostic test. But the gold standard is actually to draw blood and put on the microscope, on the slide, to look under the microscope. Now, this helps us to see the parasite. So the parasite comes in like different stages. It also helps us to see the density, okay, of the parasites. And that tells you how severe the malaria. So that's what they would write, like class, good. Okay, so that is the gold standard. So that is done in the hospital. And that is how we're able to say that, yes, this person has malaria or this person does not have malaria. Now, if you go early and the test is negative and you still think that you have malaria, the next day you can go back and repeat the test. The first day you might not see anything, but the next day, okay. But if you don't find anything, it might mean that you have something else. So please don't take the malaria medication.
Okay.
Let them test you for the other things, because it could be a urine infection. It could be some other kind of infection that's going on with your body, and pneumonia, anything at all is possible.
Because with the pharmacy test kit, sometimes you go and you test and it's negative, but you know what you're feeling, and then people like me call and they say negative.
That's me
But
fade,
no.
So yes, if you don't trust that pharmacy, you can always move to another pharmacy, okay? But ideally, I would say that maybe wait a day, okay, and then test at a different pharmacy.
Doc, how is malaria treated? Professionally, how do we treat malaria?
Right. So the treatment depends on the severity. Remember I said that there's uncomplicated malaria and there's severe malaria. Right. So uncomplicated malaria, you are able to sort of walk about, you've lost your appetite. So with that one, it's mainly oral medications, okay? Now, the first line medications are what we call the artemisinin-based combination therapies, okay? I'm sure you've heard about them. Artesunate, amodiaquine, artesunate, lumefantrine, okay? There's some newer ones, okay? Then the second line, we have something called DHAP. Okay, it's a long name. I don't even want to mention it, okay? But these are oral medications. Usually, you take it for about 3 days, you're fine, okay? But you have to take it for the 3 days and the way that you've been told to take it, because when you take the first dose, usually you're supposed to repeat the next dose at around 8 hours after the first dose. So you have to take it the way you've been prescribed to take it, and then complete the entire course. And the dose depends on the age of the patient, sometimes the weight of the patient. So what a baby will take is different from what an adult will take. Okay, so you need to take the right dose, because if you don't take the right dose, then you would have not a relapse, but it will be a partially treated malaria. So in about 3 to 4 weeks, the symptoms are still there. It's because you didn't take the accurate dose for your age or your weight. Okay, so it's important.
In the Vox Pop, some people mention that they take it
when they felt better,
then they stopped. I mean, we're all guilty.
I know, but it's just 3 days.
4 pills.
You see now the pharmaceutical companies have combined most of these 4 into one. So you're just taking one in the morning, one in the evening,
Okay.
the next day you repeat it, and the third day, then it's done. For severe malaria,
Yeah.
we need to give you injections. Okay, so injection can either be through your vein or into your muscles. Okay, and there are different medications that we give. For pregnant women, they have trimesters. There are some that they can take first, second trimester, some they cannot take assessment. So when you go to your hospital, your provider will look at which trimester you're in and give you the appropriate medication that you need. For people that are also non-immune, so people that don't stay here, they are just traveling, they need to be on prevention. They need to take medications that prevent them from getting malaria. It doesn't mean that they will not get it. They may get it, but they may not get like a severe form. Okay, so there are different formulations of these medications. They are usually oral. Some you take just a day before coming into the country. Some you have to take a week or 2 weeks or 3 weeks before, and you continue while you're in the country and continue for a few days after you leave the country, and then you stop. Okay, but when they do get malaria, their treatment is similar to those of us here, and then sometimes we add on other medications that are not given to people that live in Ghana. Okay, so these are the ways that we treat malaria.
Okay, but what about herbal medicine?
Yes.
People like to take herbal medicine instead of pills.
Right. So the Ministry of Health actually has some herbal medications that are approved. They need to contain certain ingredients. So once this is one or more of those ingredients, there are a list of them. Once these are in that herbal medication and it's been FDA approved, remember, vetted and approved by the FDA, yes, then it's okay to take that medication. But if it's not, you may be putting your whole system at risk of other complications, especially the kidneys. So please check and make sure that whatever you're taking is FDA approved. Honestly, I mean, from where I sit, I see a lot of people, young people for that matter, who abuse herbal medications, and they come in needing dialysis, and it's something we need to talk about. So please, but we are not saying herbal medications are bad, but take the correct ones, so those that are FDA approved.
Great. So we take a quick break. When we come back, we go into some myths about malaria. I know you know a lot about that. We'll be right back. Welcome back. We are still here with Dr. Freda Dodd-Glover, and we're about to talk about myths. I know you've heard about some malaria myths, so Doctor is here and we're going to clear it all out. Now, Doc, there's this very interesting one about eating garlic that helps prevent malaria. How about that? Have you heard that?
Yes, I've heard things about garlic, but then, see, now society is wonderful, eh? Garlic is smeared all over people who are having seizures. I don't see it stopping the seizures. So, yes, I mean, garlic, it has some anti-inflammatory properties, okay? So when we take garlic, it helps to boost our immune system overall. But garlic cannot attack the Plasmodium parasites and kill it. So yes, it helps boost our immune system, but it cannot cure or prevent malaria.
Okay. How about blood group? You know, there's this study that a particular blood group prevents malaria.
Yes. So it's actually true. Having the blood group O is quite protective against getting malaria.
Which of the O's?
Okay, so either of them. But usually people, I think God did it in that way, because people who are O positive, they're able to give blood. They're called universal donors. They can give blood to anybody at all. They cannot receive
which
blood
is so not fair, because I can give blood to everybody, but
but I mean, so I think that is why that protective element came in, so they don't pass on malaria to other people. Also, people who have the sickle cell trait, that is, people who are AS, they are actually quite protected from getting malaria. That doesn't mean they can't get it, but they hardly come down with symptoms of malaria compared to people that do not have AS traits.
Oh, okay. That's interesting. Thank you so much, Doc. Now, social media is buzzing. I'm going to read a few messages and then we'll see if we can discuss it. So our very first message is from Daniel from Choco. And he says that is malaria fatal or is malaria contagious? I think we've addressed that, but if you want to add up.
So malaria can be fatal. Remember we said the severe malaria, and that severe malaria could lead to kidney damage. It could lead to fluid in your lung. It could even cause coma and seizures.
The scary one.
So yes, it can be fatal. For being contagious, no, malaria is not contagious. Being contagious means that I can pass it on directly, like COVID. No.
But can the mosquito do that?
Yes, the mosquito can do that, but that's not what we mean by being contagious. Yes, that is by the spread through the vector, which is the Anopheles mosquito.
Okay. And this one is from Victoria inside East Legon, and she says, spending only a short time in a high-risk area is safe. How true is it?
That's not true, because if it's like a highly endemic area and you are non-immune, for instance, I keep saying our brethren that are traveling into the, Dirty December will be
Dirty
coming
December,
soon,
they
they'll be coming.
can.
So yes, they are not protected, especially if they have not been on prophylaxis. Okay, so there are these medications that if you're non-immune and you're moving to an endemic or a high burden area, you need to be on these medications. There are different formulations. Some you take a day before you go into the zone, you continue while you're in the zone, so a few days after you've left the zone, to some that you take weeks before you even get into the zone. So different formulations, but just spending a brief period does not make you immune.
Immune. Interesting. Before we go, do you have any final words? Anything you want to tell us
Yeah.
about malaria so we are cautious?
Sally. So I want to say that malaria kills, okay? Yes, the National Malaria Elimination Program is doing its best to try to reduce the burden and deaths associated with malaria, but we all need to play our role.
Yeah.
Okay, the vaccination is available now. It's coming close to you if it is not in your region yet. But for children between 5 months and 2 years, please, parents, do take them to get the vaccines. For those of us that can, when you're going out in the evenings, wear long protective clothes. Make sure the netting in your house, if it's torn, that you replace it or that you patch it up. Let's keep bins covered so the water is not stagnating in there. Let's clear out the garbage from our gutters, okay, so that the water can flow and it's not serving as a breeding ground for mosquitoes. And above all, my final words are: get tested, get treated. Do not self-medicate.
Thank you so much, Doctor.
You're
It was
welcome.
really an interesting conversation with you.
Exactly.
I didn't know talking about malaria could be this fun. And
Let's
thank
do it
you.
again.
Yeah, let's do it again. I believe we've all been educated and informed about what malaria is, how it's treated, the causes, and the prevention. Let's make sure to protect ourselves, our family, and our friends, because malaria can actually put you in a coma. And it can also kill you. So do you feel the vibe? You don't feel the vibe? My name is Gadade Akusumifia, and this is Health Vibes. See you soon.